Today marks 1 year since state leaders confirmed the first COVID cases here in Georgia. A father had returned to Fulton County from Milan, a COVID hotspot at the time. His teenage son also testing positive.
I remember that day so specifically, Jennifer. Since then, our understanding of the virus has dramatically evolved. Joe Hankey is taking a closer look at the lessons learned and how they could guide us moving forward.
What I remember is one of the first patients was an ICU level patient, that patient unfortunately didn't make it.
Since then, Dr. Danny Brandstetter, medical director with Wellstar, says his staff and him have learned more every day about diagnosing and treating COVID-19 and keeping families and patients safely connected.
One of the biggest lessons I learned is this is a collective action item, so we could not have accomplished it alone.
Brandstetter says responding to a year of COVID required entire healthcare systems, public health departments, the National Guard, and many others all working in collaboration. From testing to developing vaccines in under a year and now vaccinations, it's been a group effort.
It also took the communities to get involved, to get the word out there. How do they prevent the spread? How do we keep schools safe? How do we provide food and make sure our sanitation continues to happen?
Collaboration and its impact were learning moments, Brandstetter says, and those relationships should be used when responding to a future health crisis. For patients, he says how you visit your doctor for certain issues has changed forever.
Virtual visits. I do think telemedicine is here to stay. I think there's great benefits in that.
And don't get rid of your masks or forget how to social distance. Brandstetter sees those simple steps we are all familiar with eventually being used post-pandemic during severe flu seasons, for example.
We're going to look at numbers, and then we're going to know, and we're automatically going to start doing those things, right? Because, we're too high. So we got to do the right things to protect ourselves and our communities.
And Dr. Brandstetter says during a future pandemic, we would probably make some of the same mistakes that we've made during this one. We still need to work on better addressing mental health issues and finding ways to help underserved communities that are being hit the hardest. We are in a better position, he said, to adapt and switch to virtual options, put travel restrictions in place when needed, and deal with school closures.
All right, Joe, thank you.